Today we're talking with Lorie Mills with Primeau Consulting Group about Medicare You and what's the right plan for you on Medicare. Lorie, thank you for joining us today.
Well, thank you for inviting me, David. I'm very excited to share this information.
Medicare open enrollment is October 15th through December 7th. And Medicare is a federal insurance program designed for individuals 65 years of age and older. And it covers certain younger individuals who may be at end of life or have disabilities. Here's a few terms that may sound familiar to you. Provider network, in or out of network. Prior authorization. Plan changes. Advantage plans. Medicare Part A, B, C, D, and it goes on. It's all confusing. What's the difference? What does that mean for you in your health care?
You ask about the Medicare, the different parts. We were talking about Medicare A, B, C, and D. So Medicare A is your traditional Medicare. It covers inpatient services, skilled nursing services, some home health and hospice services. That is the part of Medicare that if you pay in the Medicare tax while you're working, that you are automatically receive when you turn 65. Then we have Medicare Part B, and Part B is for outpatient services such as therapies, when you go to the hospital to have x-ray, lab work, ER visits, doctor's office visits, things like that. That's what Part B covers. Part B is an additional cost to Part A. Part A is free. Part B you have to pay for. The other thing that we look at is Medicare Part D. That is your drug coverage. You have to pick a drug coverage plan when you start receiving Medicare benefits. Used to seniors did not apply for Part D if they didn't need it, and they just waited until they started medications and they would apply. We no longer can do that. You have to go ahead and apply for your Part D services if you do not have another drug coverage, such as a commercial payer that's paying your drugs that meets the qualified definition of a drug coverage package from Medicare. The reason I skipped Part C is Part C is what we call Medicare Advantage plans. There are times that Medicare Advantage plans are a little more restrictive on care that you're allowed to receive. So you do need to look at those and weigh the benefits of what is best for you. So I guess the best advice I would have is that Medicare Advantage plans may be right for some people and traditional Medicare may be best for others. But it's very important that you evaluate those for your needs and make sure you make the best decision for you.